healthcare workers going to flood-hit areas on a raft to administer COVID vaccines. The district administration of Nilgiris convincing the tribal population to get jabbed. Stories like these, which have come up often over the last few weeks, is the reason why India created a record on September 1st, over 1 crore vaccine doses on a single day. In the first week of this month, more COVID vaccine doses were administered than in the entire month of May. So, what's fueling this surge? The rollout of free vaccination in government hospitals was a primary boost. India's primary healthcare doctors also played a significant role in combating vaccine hesitancy in rural areas. These doctors, along with social health activists and ASHA workers, undertook door-to-door house calls in rural areas across the country and convinced people to get vaccinated. Even as several areas in Northeast and North India were hit by floods, the health workers kept the vaccination drive going by taking the help of disaster response forces. They also held village-level meetings and announcements via speakers and organized local camps and drives. Rural areas are leading this current mini-surge. This month, on average, the rural versus urban vaccination ratio has stood at 2.3:1. This means for every person who gets vaccinated in an urban area, at least 2 to 3 people are being vaccinated in rural areas. Government officials also came up with unique ways to ensure vaccination. Door-to-door inoculation, drive-through vaccination and 24/7 vaccination centers have been set up by several states. In the Nilgiris, the administration banned the sales of alcohol for unvaccinated people. Politicians also came up with incentives to expand vaccine coverage in their constituencies. Vishnu Katari, a BJP MLA in Madhya Pradesh, announced free mobile recharge for all vaccinated people in his constituency. DMK MLA Udaynidhi Stalin conducted a door-to-door campaign and distributed provision kits to vaccinated people from his constituency. The government is also planning to use drones to ensure vaccine coverage in remote rural hamlets. On September 13th, the Civil Aviation Ministry granted conditional permission to the Indian Council of Medical Research to use drones in Andaman and Nicobar Islands, Manipur and Nagaland to deliver vaccines beyond the visual line of sight. It remains to be seen if all these efforts will culminate in helping India achieve 100% vaccination by the end of this year. A federal report.